Hello everyone. Today we'll be studying about candidiasis. In earlier session, we have studied about bacterial vaginosis. You can check out my previous session. Now, without wasting time, we'll move on to our topic today. About 75% of the women experience at least one episode of candidiasis. They will experience at least once. Now, what is the most common cause? The most common cause is Candida albicans, which is responsible for about 85 to 90% of the cases. Now, what are the other causes? The other causes are Candida glabrata, and Candida tropicalis. Now, we'll understand what are the situations in which candidiasis is very common. The two situations are warmer climates, and next is obesity. Next, we'll understand what are the predisposing factors in which candidiasis occurs. The main predisposing factor is immunosuppression. What happens with immunosuppression? There is reduced cell mediated immunity, therefore leading to increased incidence of candidiasis. Now, what are those predisposing factors? This can be diabetes mellitus. Number two, this can be pregnancy. Now, patients who are on steroid therapy, who are on prolonged antibiotic use, these are the most common. Another thing is who are regular ocipil users. They have also the increased preponderance of having candidal infection. Now, next we'll understand what are the symptoms. What are the symptoms of candidiasis? First is intense pruritus. Intense pruritus in bacterial vaginosis, pruritus was absent. As we said, there was no inflammation and no itching. Here, the main symptom is intense pruritus. Others can be pain, vulvar pain, erythema, edema, and excoriations. Why excoriations? Due to intense scratching. These are the main symptoms. Next, we'll move on to what are the signs. First is the vaginal discharge. How the vaginal discharge looks like? It looks like curdy or cottage cheese appearance. It has the curdy or cottage cheese appearance is a typical one. Next, on adding 10% KOH to the vaginal discharge or normal saline, we'll be able to see under microscope fungal elements. What are those fungal elements? What you will be able to see? We'll be able to see hyphae or pseudohyphae or fungal buds. These are the basic characteristic of microscopic examination. Next, what is the vaginal pH? Here, the vaginal pH is less than 4.5. Number 4, what will happen on VIF test? VIF test is usually negative. Now, will you do the vaginal culture in case of if you are suspecting candidiasis? No, the answer is no. Cultures are not usually recommended unless, but there is an exception. If you are getting a patient of recurrent vulvovaginal candidiasis, or if the patient is not responding on the normal empirical treatment, then you will go for vaginal discharge culture. Next, there is a CDC classification. About uncomplicated case and complicated candidiasis. Now, this is uncomplicated. Uncomplicated cases are sporadic or infrequent, while complicated cases are recurrent. Now, what is the cause of this uncomplicated? These are caused by Candida albicans, and complicated cases are occurs due to non-albicans candidiasis. Okay. Now, the symptoms here is mild to moderate. Mild to moderate. Here you will get severe symptoms, and it occurs in immunocompetent women, but here it occurs in the immunosuppressive women. These are the basic difference of uncomplicated and complicated cases. Now we'll move on to the treatment. Now the treatment is usually azoles are the most effective treatment. You can either give oral azole or you can give topical azole. I will attach a photograph where we'll get all the drug names along with the doses by which you can give, but I will give you the most commonly given treatment and which you can also give. Next, you have to study by your own what are the things which you can give topically and what are the things you can give orally, what is the dose. And if you have any topic, you can give doubts or comments in my comment section. So what is the most commonly used drug? The most commonly used drug is fluconazole. And what is the treatment? The recommended treatment is 150 milligram single dose. 150 single dose you can give. But in case of complicated cases, what you can give, you can repeat another dose of fluconazole after 72 hours of giving your first dose. Again, you can also give topical treatment. You can give topical azole drugs. Next, we'll move on to if the patient is having recurrent candidiasis, what you are gonna do. So, what is basically recurrent vulvovaginal candidiasis? You have to know. So, recurrent vulvocandidiasis means if you're having a patient with 4 or more episodes in a year of candidiasis, then you will call it a patient of recurrent vulvovaginal candidiasis. In that case, what is the treatment you will give? The treatment you will give is remission course. You will give remission of chronic symptoms, with fluconazole every 3 days into 3 doses. And next you will give her suppressive maintenance dose. And what is a suppressive maintenance dose? It is 150 milligram of fluconazole every week for 6 months. So this is it. So this is a very short class of candidiasis. I hope you are having your doubts being cleared. And if you have any doubts, again I will say you can give comments, you can message me. Next, so thank you so much.